Yes, ma'am.
Okay, so if you've read and understood, considering it
Yes.
surgical or not mistake, please tell me if you could identify a picture on the left-hand side.
Yes, ma'am. It's a cadaveric image of the chest,
Okay, showing both,
mediastinum,
right, and
and the lungs,
okay, right, lungs and the organs like viscera
organs, vertebra, both
has
of
been
the vertebra.
removed. Okay,
Yes.
vertebrae are there. Please tell me what is mediastinum?
It's the containing cavity of the hearts and pericardiums and blood vessels, nerves
And
in the chest.
and it is
And the
classified or divided into, please.
thorax, thorax,
Not thorax, mediastinum, please.
mediastinum from the heart, sorry, other lungs.
Can you, in a very nice manner, tell me the classification or division of the mediastinum?
Yes, it's divided firstly in superior and inferior mediastinum, a
Right.
line joining the sternal angle to the thoracic four vertebra. Then inferior mediastinum again divided into three parts: anterior, middle, and posterior by the pericardium. The anterior portion of the pericardium is anterior mediastinum. Within the pericardium is the middle mediastinum. Behind the pericardium is the posterior mediastinum.
Okay, please tell me the contents of the posterior mediastinum.
Yes, ma'am. It's contain the esophagus, thoracic tract, phrenic nerve,
Can
greater
you
laser.
please, while you are telling me, identify here the structures that you are mentioning? What is two, please?
To
Here.
the thoracic duct.
Not possible. Okay, if you could identify, right. All right, okay. Which vertebrae are these?
Is the thoracic vertebra.
Okay, please tell me at what level bronchi enter the lungs? At what vertebral level bronchi enters the lung?
Thoracic 4.
And what are the lobes? Okay, tell me the lobes of the right and left lungs, how many there are?
Yes, right lungs have three lobes divided by the two fissure, horizontal and oblique fissure, and the left lungs only the oblique fissure and two lobes only.
What do you understand by the term bronchopulmonary segment?
Is a segments. It's a 10 segments in bronchopulmonary system.
No, not the number, please, definition. Okay, we'll come back to this later. Please
Yes.
tell me, now you've already told me how many bronchopulmonary segments there are in each lung. That was my next question. Okay, please tell me the blood supply of the lungs.
Yes, ma'am. The bronchial artery on the right side, one bronchial artery, and the left side, two bronchial artery.
Okay. On the right-hand side image, you are looking at the lungs.
Yeah.
Please tell me which one is which and
Yes,
how
ma'am.
you differentiate.
Yes. The number one is the bronchus, principal bronchus.
No, which lung is this? Right
Oh,
or left?
sorry, left lungs. It's left
Okay.
lungs.
Why?
The oblique fissure,
Okay. And which one is this?
right lungs.
Okay, please identify these impressions or tell me what are the what are the contents of the pulmonary hilum?
It contains the pulmonary artery, pulmonary vein, main bronchus, uh, then lymph nodes.
Okay, please tell me the lymphatic drainage of the lungs.
Lymphatic drainage.
of the lungs. Okay. We'll come back to that later. Please
Okay,
tell
ma'am.
me how many pulmonary veins drain each lung?
4 pulmonary vein.
Okay. And if you could tell me, right, in which bronchus or right or left, if a child aspirates a foreign particle, it will lodge
Yeah, ma'am.
into
It's a,
which?
right side.
And why?
It's a short and straight.
Okay, please tell me from which embryonic pharyngeal arch the internal, oh, okay, these, right, I'll ask you these later. Right, which embryonic pharyngeal arch will disappear and it will give rise to any specific structure? You have to tell me if you can remember.
Can't
No?
remember, ma'am.
Okay. On the picture on the left hand side, you're looking at an
Yes.
structure. Can you
Yes,
recognize
heart.
it, please? Okay, please tell
Yes,
me.
specimen of heart.
Yes. If you could tell me the layers of the pericardium, how many are there?
Epicardium, pericardium, and myocardium.
Oh, you're telling me
Oh, heart, layer of the
you
heart.
have, it's
Yes,
very important,
serous and parietal.
very important to listen to the question, right?
Yes, ma'am.
Pericardiums, right. Okay, then you have to tell me what are the structures at the risk if you damage pericardium during pericardiocentesis, or what are the structures which can get damaged when you're doing pericardiocentesis?
The vessels, great coronary artery, interventricular groove, the muscle.
Okay, please tell me if a child is born and has a patent foramen ovale. So please tell me what is the function of this foramen ovale? Okay, if you could tell me what are the structures ductus arteriosus connects to in the fetus, if you could recall.
Ductus arteriosus become the septum, septum transversum.
If you could tell me, right, where is the commonest site for coarctation of aorta? And if you could tell me, right, you are not being able to, please tell me the arterial supply of the heart.
It's supplied by right and left coronary artery.
Okay. Is that all?
Mainly the arteries supply right and left coronary artery and their branches.
Okay. Would you be able to identify the structures?
Yes, ma'am.
What is 4, please?
Pulmonary trunk.
Can you please identify number D?
D is the yes interventricular branch of the left coronary artery, branch of left coronary artery.
Not quite. Okay, yes, but you have to like, okay, can you identify one, please?
Is a right atrium.
Right. Okay, good. Moving back to this image, we could not identify or we could not. Please tell me, if you could tell me, what are you looking at?
Yes, it's the lungs and the some nerves and the vertebral level.
Would you be able to identify what this A and B is pointing at and what is this B?
Yes, ma'am. It's difficult to say, but it thinks it's the sympathetic chain and ganglion.
Okay. The one sympathetic chain is where? All right, okay. If you could, yes, B is right sympathetic chain and A is right intercostal artery and vein. See, here it's showing you these two are together. That's why. If you could identify number C, please. Can you tell me what exactly is being reflected? What is this being reflected on the side? And you are being asked to identify number this C.
Ma'am, picture is small looking.
Yeah, change your mobile, get a better one so that you can zoom and see. See, this is
Yes, ma'am.
phrenic nerve, okay?
Yeah,
If,
panic now.
yeah, you were supposed to identify. They can give you image like this and you are asked to identify that this is phrenic nerve. All right, if you could identify superior vena cava in this image.
Yes, ma'am. I'm trying.
Okay, it's
It's
this
superior.
one, D.
D is superior vena cava. Yes,
Yes.
yes, ma'am.
And the E is right principal bronchus.
Principal bronchus. Yes.
F is right pulmonary vein and G is pericardial sac. So this is
Yes,
pericardium
ma'am.
which is being reflected so that you could
Yes, ma'am.
see. What is number 3 over here in this image?
It's the uh, pulmonary. It's the pulmonary artery.
Are you
No,
sure?
ma'am. It's a pulmonary vein. It's the end. Posteriorly, it's maybe the bronchus.
Yes, most likely.
Bronchus.
Yes, please. And what is 8?
It's a diaphragm.
Come on. Is it diaphragm? Okay. Could
All
be
the
even liver.
it's the pulmonary ligament.
Yes, and this could be liver.
Yeah, ma'am. Pulmonary ligament.
Yes. All right. Okay. Thank you.